Okay, good afternoon，各位午安。我哋今日咧，我會同一個精神病科嘅醫生Dr. Edwin Tam 傾一傾偈。First of all, I have to say, we are not dispensing any medical advice. This is just a chat. So if you have any question, go to your own healthcare provider. And I'm sure they will offer you a lot of help. So Edwin, nice to see you. Actually, yes.
Thanks for having me.
Yeah, really, really nice to see you. Nice to have this opportunity. Can you just briefly introduce yourself?
Okay. So I'm Edwin Tam. I'm a doctor, a psychiatrist. I work out of in Vancouver, out of UBC Hospital. That's mainly where I do my outpatient with mood disorders. And inpatient, I do a mix of mood disorders and general psychiatry over at the Vancouver General Hospital.
Oh, okay, good. Now, since you're a psychiatrist, and for a lot of the viewers, including myself, I'm sometimes totally confused about those names. Psychologist, psychiatrist, licensed counselors, psychotherapists, psychoanalysis, and a lot of other names, similar professions. Can you briefly, in a layman's term, explain to our viewers what are the differences and what are the different focus, the different training, and what's the difference?
Yeah, okay. So, I mean, if we kind of go in order of training, probably a counselor, pretty much anybody can hang up a shingle and call themselves a counselor. You know, we have life coaches, people who've, gone through experiences and feel they have something to offer. And, anybody can call themselves a counselor if they do some talk therapy and counsel. There are some organizations that kind of license the counselor if you have references and such. So they tend to be, if you sign up, you can become a licensed counselor. And these different organizations may have different standards. You may need reference letters or years of practice and so on. And then if you kind of go on to, a lot of the therapists tend to have some, more organized body. I think most notable would be the psychologists. So psychologists have to go to actual university for a degree in psychology. Usually it's either a master's degree or even a PhD. So a lot of psychologists out there who are in practice have a PhD or at least a master's. And they can join a professional organization that kind of sets standards. So you'll be part of that group and held to account as a professional. Depending on the type of training, some psychologists are very specialized in some types of psychotherapy. So they, in addition to their PhD, they may get extra training, in terms of what they did as their the fellowship and so on, if they pursue that. On a different track would be the psychiatry. So psychiatrists, you would go through medical school first. So you become a medical doctor first, and then you specialize doing residency in psychiatry. And I guess for the public, the main difference is that because you're a physician, you can also prescribe medications. So you tend to be able to prescribe medications and do psychotherapy, whereas the psychologist can only do psychotherapy, but they may have had more specific training in that type of psychotherapy. Yeah, probably the commonest form of psychotherapy these days, especially with psychologists, is cognitive behavioral therapy, so CBT. There's other branches like interpersonal psychotherapy, IPT, which deals with people's relationships more. There's things like ACT, so there's all these types, that are kind of basis, and the psychiatrists will tend to have learned that, but they may not have, been as focused on it as the psychologists who are just doing that.
Okay.
Now when you go into things like, so what is psychotherapy? It's just basically talk therapy. So that's a big umbrella term. And then psychodynamic therapy, I think you mentioned, psychoanalysis. That's a very specialized. You can be a psychologist or psychiatrist doing that, really you just have to have had psychoanalytic training. And this is what people talk about when they talk about Freud, looking back at childhood, sitting, or lying on a couch, many days, just to really kind of see, what's inside your deep psyche, and that would be psychoanalysis. And that's probably not as common these days, just because people don't have the time or money to really go through that. But yeah, that would be like the old school, type, as opposed to, let's say, the cognitive behavioral therapy and so on, which are more focused on the present, the here and now.
Okay, so they do focus on various aspects. So it's not that one may be better than the other. It depending on the need of the patient or the client.
Yeah, in general, most of the psychotherapies tend to come off as even in terms of, what works better. I think it comes down, there are some specific psychotherapies that work better for some things, like DBT works better for borderline personality disorder, so there are some specific ones. CBT, is very good for, let's say, obsessive compulsive disorder. So there's some disorders where clearly one has, but in general, it would really depend on the needs of the patient, their availability, their inclination, and what they want. And there's, really at the very basic, there's also supportive psychotherapy. Just having somebody to talk to can be very helpful. And that's what a lot of counselors do. And without being a specific brand, just having a supportive therapist, can be very helpful.
I see. So, because I know some support groups, maybe even for immigrant support groups, they talk about their feelings, the cultural shock, the change. And of course, there are other support groups like Alcoholics Anonymous and Narcotics Anonymous. Then, they may not have a training in psychology, official training in psychiatrists or psychologists, but they do have.
That's right.
Okay.
Yeah, I think that's a very good point, that there's also a whole other branch called group therapy. And you do see different types. There's some of them are quite self-help, basically people who've gone through it, coming together. Nobody's had any special training, but they share experiences. And then the other one where you have groups led by somebody. It could be a counselor, it could be a social worker, it could be a nurse, somebody with some training to lead the group therapy and just kind of guide them. And then there's, different models of group therapy as well. You can have cognitive behavioral group therapy. You can have, DBT done as a group. So all these different combinations.
Since we are talking about groups, so for example, if somebody who is new to this country, they definitely will face a certain degree of cultural shock if they have to leave the place that they were brought up, they were born. So how does it affect their mental health, and what should they look out for?
I mean, I was looking into the, knowing that I would be doing this interview, just Googling the terms and such, and there seems to be a kind of a general consensus that there are different phases of culture shock. So a lot of them roughly break it down to like 4 or 5 phases. The first one being the honeymoon, where it's quite exciting, and to be in a new place. You see all the very positive about it. And the next one, some people call either the crisis or the anger or the phase, where basically you realize how different it is, and it's hard to adjust. And so it becomes a bit of a crisis where you that's where you probably can get a lot of the symptoms, and different people experience it different ways. Some people find they're more irritable. Some people like socially isolate, they don't want to go out. Some people may feel feelings of feeling very unsafe, or they might feel very critical of the new place. Some people have sleeping problems. Some people find that they just kind of lose their energy to do things. So it can present in different ways, which is quite normal. And then after that becomes the adjustment phase, where you start adjusting. You start trying to adjust and change it so that you can get used to the new way of living, the new way of interaction, the new culture. Once you feel comfortable, they call that the adaptation phase. Once you feel adapted, then you actually feel comfortable in that. And interesting enough, some people talk about a 5th phase, where if you have to travel back home, some people talk about re-entry shock, where going back home becomes the difficult one because it's changed, or you've changed, and going back home is very difficult. So those are kind of roughly phases. I think that the most difficult one is that, phase at the beginning, the crisis, or, before you're adjusting, where you kind of may feel very emotional, during that time and feeling very out of place.
Yeah.
So our worry as a psychiatrist is if that starts drifting into what we call a clinical depression or some other psychiatric disorder, then, you may need more treatment than just kind of going through it, So there's kind of suggestions that you can have for the, to help adjust. And, those might include trying to be interactive, go out, don't just stay at home, try to learn about the new culture, learn the new language, get a new network. It could be other immigrants who've also come in.
Yeah.
It could be talking to locals and get, bonded. I think there are a lot of support groups. I think you're part of some of them, where they are trying to help immigrants integrate. And so that can be also a source of, a good social connection. Community centers, church groups. So there could be a lot of, any kind of shared interest can sometimes be, a focus, or where you can get more social connections. And of course, just generally taking care of your health, exercising, socializing. So sometimes an adjustment part, or the crisis part of culture shock, our worry is if it gets too severe and it becomes what we call a clinical condition, like it could be a depression, it could be like a generalized anxiety disorder, where basically it becomes a medical condition, then you might need more aggressive treatment. And one thing I can do if you want is we can go over the symptoms of depression and kind of give you an idea what that is.
Okay, please.
Would that be helpful? Okay.
Yeah.
So the difference between just feeling blue or feeling a bit down, which we all have, and a clinical depression is basically in terms of severity and duration and the effect on your function. So in terms of severity, we usually look at number of symptoms. So the number of symptoms that there's basically 9 basic symptoms of clinical depression. So one would be low mood. It's, if you have trouble enjoying yourself or enjoying things, like loss of interest, If you have difficulties with your sleep, it could be too much or too little. If you have difficulties with your appetite, again, too much or too little. You can have energy changes. You can have, usually people feel low energy when they're depressed. You can have concentration difficulties. So you can't focus, to read or conversations. People may notice that you seem slowed down in terms of how you move or how you talk. There's some people have low self-esteem, like feeling worthless or feeling guilty. And then most serious of all is, of course, suicidal ideas. So usually we talk about clinical depression if you have 5 of those symptoms. Like you have to have low mood or lack of enjoyment as one of the main symptoms. But if you have like 4 other symptoms on top of that, for a total of 5, and it's going on every day, most of the day for 2 weeks, that's what we start talking about, that maybe it's a clinical depression. Because most times of us feeling blue or down, it doesn't go on with all these symptoms for 2 weeks. Once it hits that number of symptoms for 2 weeks in a row, every day, then we're looking at clinical depression. And then the treatment for that can include things like psychotherapy. All those therapists that we talked about can also include medication too. So that's something to watch out for, because if it gets quite serious, of course, the worst case scenario being that, it will affect their function. And again, most of the time we talk about with depression, 2 weeks, 5 symptoms, but also affecting your function. Either you're not able to work, or it's causing you a lot of distress, or you're not able to do your home chores. That's when we start talking about, that. And if the function gets too bad, you can lose your job. If it gets too bad in terms of suicidal ideas, one might even kill oneself, right? So those are kind of the things that we definitely want to avoid. Sometimes people even need to be hospitalized if it gets to that state.
But there is a problem though. Now, if I cut my hand, or if I cough, if I have a fever, I know myself. Look at the mirror. I know there's something wrong with me. You either get a doctor, or even just go to the pharmacist and ask the pharmacist. Or most people will search for help. But if I'm depressed, lost energy, etc., I'm already depressed and lost energy. I'm not going to make out a list to say, okay, these are the 9 things, and I'm going to count my days. Is it 14 days yet? Continue. If I'm in a mood problem or
Yeah.
depression, I
Yeah.
won't do that. So
Yeah.
how?
Yeah. So that's where we totally believe in more public education, that they know how to recognize the symptoms. They might go for help, or family recognize that their family is going through that. So just like those campaigns to, tell people what the stroke symptoms are, like fast, we
Yeah.
similarly, try to encourage people, if you notice this is happening, sometimes people feel so miserable, they actually look for help because they just feel so down. But you're right. A lot of times they don't realize that going to a doctor is totally appropriate, because they think they have to go to the doctor only for physical concerns. But no, most family doctors are quite capable of treating a depression.
Mm-hmm.
There's a particular difficulty with Asian populations,
Yes.
is that, oftentimes there's a phenomenon seen many years ago, that in China, they seem to be reporting less depression. But they had this
Okay.
alternate thing called neurasthenia, which was just like low energy, aches and pains, low motivation, which looked like depression, except for they weren't saying that they were feeling sad. And so the understanding now is that in some cultures, like in that case, the Chinese culture, it was not acceptable to say, I'm very sad, I don't think I can go to work. But if you say, oh, my heart hurts, my body doesn't feel right, then it's acceptable form of,
Mm-hmm.
being sick. Then you would get support. So there seemed to be this emphasis on physical symptoms as
Okay.
opposed to
Yeah.
emotional symptoms. And so I think the current thinking is that neurasthenia that we find in China is really just depression in other parts of the world, without them saying that they're feeling very sad. They're just,
Yeah.
it's all physical. Yeah. So that makes it particularly difficult. But then I'm hopeful that these people will go to the family doctor to complain about the physical. And then the
True.
doctor will figure out that it's actually psychiatric. Yeah.
Yeah.
Once they do all the tests, of course. And that's usually the first step, is that there are some physical symptoms that look like psychiatric. Like if you have low energy,
Mm-hmm.
and you can't, don't move as fast, you could have anemia, you could have low thyroid problems. So you should get it checked out by the family doctor first. That's usually the first step. And then
Mm-hmm.
if it's all clear, then maybe, that you're physically very healthy, then maybe it's a depression setting.
Okay.
Yeah.
You mentioned there is a cultural, cultural
Mhm.
difference, and is especially in the Chinese culture, going to see a psychiatrist
Yes. Yes.
carries a stigma to it.
Mhm.
Nobody wants to be
Yeah.
called 痴線神經,
Yeah.
right?
Yeah.
So, by the way, Edwin knows Cantonese. He's just not not very
A
fluent
little
or
bit.
comfortable doing an interview. Uh, so, and no Chinese
Mhm.
one, it is for a lot of Chinese, it's a degrading. They feel
Yeah.
degraded. They feel just don't,
Yeah.
And so, how do you suggest? Yes, education and awareness, but how do you suggest especially the Chinese community or any community at
Mhm.
all, can say, well, we have to get rid of that stigma, and
Yes.
mental health is actually health.
Yes, yes, exactly. Very difficult. I do notice, I'm involved in Vancouver. There's a self-help group, kind of like the type you've mentioned, where people who've had depression got together to talk about their depression. I think that was one step. And, because you go to this group and people are there, like Alcoholics Anonymous will say, I've gone through depression, and it's okay. That helps to destigmatize it. I think if more public figures, are willing to say that they've dealt with depression, just like we've noticed that with Western culture, you have, a lot of famous people, including like, Dwayne The Rock Johnson, who kind of said, I went through a depression myself. I'm a big tough guy, but I also had depression. I think the more you have public figures come out, that will also help. I think like you say, a lot of times it's quite an insult, TC and King, and
Yes.
so and yeah, if we could pull back, like in the old days, kind of like calling people like mentally retarded was an insult, and now it's
Yeah.
become not acceptable. I think hopefully one of these days calling people crazy and that is also going to be less acceptable. But yeah, I totally see it. Even with my own relatives, the insult is, oh yeah, you have to go see Edwin. That's the insult. That you're kind of crazy. So yeah, it is very common, and there's a stigma. I think also in Asian cultures and even South Asian, I've kind of noticed it almost, there's a sense that it taints the whole family. If you have mental illness in your family, that your whole family, there's something wrong with family. And I think that also makes it very hard for people. I have one story, when I was training in psychiatry, I'd have to say when people found out I was a psychiatrist, a lot of the Westerners would come up and say, oh, I have a relative who's sick, or I have, so-and-so with schizophrenia, or I have something. With the Chinese people I knew, nobody ever said anything like that. Even though some of them I knew had relatives because I saw them in the hospital. Nobody really wanted to say that they had a relative. They were much more tight-lipped about it. And we often see that also in with Asian families. Some of the research that they wait a lot longer before bringing in people for help. So there was one study where the people who showed up, there was less Asians showing up for treatment, but when they showed up, they were sicker. So it almost seemed like they would hold them. And I think it's also helped because a lot of Asian families, they live all together, multi-generation. So you can kind of have a relative in the house, whereas, I think sometimes Western culture, because they're very more nuclear, they've moved out, they don't have the family support. Sometimes the family will just take care of them as if it's like almost a hospital, and, keep taking care of them to keep it kind of, in the family. They don't bring them to hospital. They just kind of keep it in the family.
Keep everything in the family. There's a shame. I call it, there's a shame factor here.
Which is unfortunate, because then they sometimes don't get the help that they need. It's really, I've had some very sad cases of people not treated for many years until finally the family couldn't take care of them. And then once they got the treatment, they were all surprised how much better that person got. And I was thinking to myself, you could have gotten treatment 20 years earlier, but they just didn't. So it's a difficult problem. You're absolutely right.
Yeah, that's one of the reason when I was preparing my channel, I said, well, maybe this is the time that I have to go and talk to Edwin. So because it is the awareness and the tear down the stigma. When I was teaching, I went to some of those clinics to how to help students and all that, right? I remember one of the trainer happens to be a psychologist. And she said, everybody got mental health. Either you get good health or bad health. I think that is one of the statement that, I forgot everything in that training session, in that few training session, but that statement stick with me because we all want good health. That's why we go to the gym, we go eat well, and all that. But on the other hand, mental health, especially for Chinese or Asian, it seems it is a forbidden topic even to talk about it. So good health or bad health, that is no health at all, right?
That's right. Although one of the interesting things that one of the exercises we often recommend for people to de-stress, like we talked about generally in terms of the culture shock, how stressful it is. There's a lot of common things that we teach to help people de-stress that have nothing to do with medications. And that's basically like deep breathing exercises. There's all meditation apps that are available too. So, even if you didn't want to see a doctor, getting involved with those things can be very helpful. But I guess what I find interesting is that there are a lot of Eastern practices that involve deep breathing. Heigong, Qigong, Tai Chi, Taikek, they actually have a deep breathing component to it that can help people relax. And so, Westerners, I think they like to flock to yoga. That's the kind of more trendy thing. Or TM, transcendental meditation. But even if you're Asian and you want to do like more Heigong or doing Tai Chi, that could actually help you deal with stress as well. And it's often I remember I think we have relatives who Heigong was very good. I remember hearing it as a child. So
Okay, good, very good. So I think that is all for today. If I have any other from the inbox, or if you have any other suggestions that I can build into my channel, we'll do it over again. So let's stop it right now. So see you later. Bye bye.
Take care. Thanks for having me. Bye.